Hi everyone, I've just finished recording my live health phone-in show today where we discuss lots of different medical issues, particularly related to going into the winter months. So as you know, I'm a diabetes doctor and I specialize in hormones, so I'm an endocrinologist, but also I do acute internal medicine, which means that I am in the emergency department on call, seeing admissions, emergency admissions, and I was on call. I did a 13-hour shift yesterday. And I saw lots of people come into the emergency department with things related to chest infections, asthma, urine infections. I had one patient that I sent to the intensive care unit. He was very ill with a really bad chest infection, and another young patient I saw with asthma. So these are also areas of interest of mine. So I'd really encourage anyone with any breathing condition, particularly going into the winter months. If you have asthma, for example, please sort out your medication. Make sure you have a supply of your inhalers. Make sure you're taking your inhalers regularly before going into the winter months. Make sure you get a nurse appointment or a doctor's appointment to go through your medications if there's something you're not clear about. You can get help from your local pharmacist here in the UK and the NHS as well, because the last thing I want is people to run out of their medications and end up in the emergency department. And another thing that I saw really 2 or 3 times yesterday was a urine infection. So again, this tends to affect younger women and older women, although it can obviously affect men. But if you're having symptoms of a urine infection, then again, please don't ignore it. The easiest thing that you can do is give a urine sample into your doctor and see if there is truly a bacterial infection and get antibiotics. So don't ignore it, because if you have a urine infection and you don't have it treated, then that can progress. So these are just a few things that I wanted to reflect upon and try and help people as we go into the winter months, because as we all know, doctor's appointments are difficult to get over the winter. You don't want to be left in a situation where you've run out of medication or you're feeling ill. So anyone out there, I'd really implore you to really take control of your health over the next few weeks. And if there's anything else you want to ask or discuss, I'm a diabetes doctor and an endocrinologist, but I also do general medicine, so I can try and answer any of the other questions based on my experience and points of view. So if you have any questions or queries, please reach out to me. Many thanks.